Hi there. This is Dr. Nicole Salvatore. I am the clinical director of Telemedica and also owner of Valor Telehealth, which employs psychologists to work with veterans all over the country and even all over the world sometimes. Today we're going to be talking about how to prepare for your interview and your evaluation for an IMO. And an IMO for us is an independent medical opinion. One thing to know about that is that for us, our IMOs are designed to provide a diagnosis, find links between your mental health issues and your service, and also to provide some suggestions and resources so that you can get the mental health care that you need. I don't see if anybody has any questions. I'd love to hear them, love to answer anything that you might have. So what should I do if I forget to mention something during my evaluation? If you forget to mention something during your evaluation, it depends on how important you think that is. Just like a regular doctor where you might go and see, your general practitioner and say, I think I have a sinus infection, and you list off certain symptoms. Psychologists work that way too. So what I mean by that is, in that scenario, you would go in and you would say, my sinuses hurt, I have, my nose is stuffy, et cetera, et cetera. The doctor will look at you and they'll say, oh yeah, you have a sinus infection. Psychologists are that way as well. So for example, with PTSD, we're looking for certain markers and certain symptoms to say that you do have PTSD. And because this does go to the VA, we're looking for evidence. The VA doesn't take things just based on word of mouth, either from a psychologist or from a veteran. And so in that instance, what we have to do is prove that these symptoms have been ongoing and are linked to service connection. So if you do forget something and it is relevant to your diagnosis, you should definitely contact customer support and see if that can be added to your IMO. Now, sometimes your provider may not think that that's necessary to support your claim. What we're really looking to do here is make it so that your IMO is easy to read and understand for the VA so that you can be service connected for your disability. So it really does depend on the length of information. However, the best thing to do if you are worried about forgetting something is write down what you want to say beforehand. So if you, like all of us, have Googled symptoms of a mental health disorder, you might want to write down how you know that you have that disorder or why you think you have that disorder, other people who have witnessed your behavior, your symptoms, and always provide a buddy letter if possible, because that way our psychologists can gather as much data as needed to make sure that you do get that service connection if you need it. Any other questions? So what do I do if I don't have all my medical records? That's unfortunately a common thing as well. Things happen. It's the VA. A lot of our veterans have also been served for a long time or served a long time ago. So in that situation, what you're going to want to do is contact the VA, contact your regular general practitioner. And if you can't get those records, which does happen sometimes, again, you're going to fall back on that buddy letter. If you do have any kind of therapist, psychiatrist, even your regular doctor that's providing you any kind of mental health care, getting a letter from them and providing it to us can also bolster your claim and make up for the fact that maybe those medical records aren't all there. Of course, if your medical records do come in after you've met with your psychologist, you can upload those to your drive and let your coach know. Following that, we can request that the psychologist add that information. However, that's up to the individual provider. And so sometimes that may not get added in. It's very important to make sure that at least 2 days before your interview that you have uploaded those medical records. And if you don't have them, come up with a way to document what has gone on for you in a different way. So again, that buddy letter, letters from your psychologist, your psychiatrist, your doctor, anybody who has seen you and has witnessed these things ever since you started experiencing the symptoms. Any other questions? What kind of documents do I need to submit before my mental health evaluation? That is a really good question. Your DD-214 is very important, your blue button records, e-benefits, any awards that you've received, again, that buddy letter, and if you have any kind of photographic documentation as well of the things that have happened to you or that you've experienced. For example, many of our veterans have experienced some physical ailments that have led to mental health conditions. In those circumstances, it's good for us to see, the changes in your body that have led to these mental health issues. The other thing that's very important is that you fill out our intake forms. These are screeners, so they cannot lead to a diagnosis per se, but they help us to know the severity of your symptoms. So if you answer those honestly, then we can use those to support your claim and to support your diagnosis later on. So what happens if my claim is denied after using Telemedica? So just like any doctor, or when you do go to the doctor, in that sinus infection scenario, you go to the doctor, you say, I think I have a sinus infection. The doctor may say that you don't, and you might get a second opinion, and you might, have to do something else. In this instance, you may come to us, we'll say you have something, you go to your C&P exam, and they disagree with us, and your claim gets denied. There are two things that you can do then. You should contact customer support and submit a help desk ticket. And when you submit that ticket, please put in your denial letter into your folder. This will then be handled by me because I am the clinical director, and I will talk with your provider to see if we can write something called a rebuttal letter for you. Now, a rebuttal letter is not a nexus letter because we can't provide those, but a rebuttal letter just says why we believe that our diagnosis is correct and why it should be reconsidered. You can take this rebuttal letter then to back to the VA, try and resubmit your IMO. You can also try and take this to a higher level if you do get denied. So that would mean having it go for a higher level review. However, don't go to a higher level review before you've talked to us. Once your claim has been in a higher level review, and if it gets denied in that higher level review, we cannot resubmit that IMO, and you would have to go through the whole process with Telemedica again. So it is best to alert us. Our doctors are usually very happy to write a rebuttal letter and even to communicate with the VA as necessary. So we try to support you the best that we can, even beyond that initial evaluation. So can my spouse be with me on the call? I actually recommend this. Spouses do a great job of seeing behaviors and symptoms in a way that maybe we don't. The other thing about having a spouse there is that's another form of evidence when we do write the IMO. A spouse saying that you have these symptoms, that this is when they've witnessed it, and giving specific dates and examples is very helpful to your IMO. However, you know your marriage best, and if you think that it would be difficult to talk about your feelings, about what happened when you served with your spouse there, then I would recommend having your spouse come in later on, or maybe just writing that letter. It can be very difficult to meet with our psychologists because you're going through very hard things. And sometimes veterans who have served, especially who have combat deployments or have experienced MST, don't want to talk about those things in front of their spouses. And just like with anybody, it is important to tell our psychologists when you feel uncomfortable, when you need a minute, and when you don't feel comfortable talking about something, because that way we can tailor the interview to best support you while still getting the information that you need. So it is always okay to tell one of our psychologists that you don't want to talk about something right now and that you need some space to deal with those things. Similarly, if you say, hey, I want her to leave or I want him to leave until we're done talking about this, that is also acceptable, and your spouse should be made aware of that beforehand. If your IMO has errors, that's another thing that you would submit to the help desk. And when there are minor errors, so things like your name was spelled incorrectly, or they got one digit wrong on your social security number, those kinds of things, that's submitted directly to your provider, who fixes it within 24 hours. But if it's something that seems much larger to you, I'm the one who handles that. I review those things, talk with your provider, talk with you, talk with your coach, and usually we're able to make the correction pretty quickly. If there are huge errors, then a lot of the time you can have a reevaluation, though unfortunately, sometimes veterans do forget things and they notice that there is an error, but that information wasn't told to the provider. In those situations, you have to be scheduled with the provider again and go through the whole process again, which can be difficult. So I would say if you do notice an error, make sure that you reach out to us. If you think that it's big enough that the whole process needs to be gone through again, just be aware that that is to help you. It's not for us to personally benefit off of your pain or suffering. It's more to make sure that we provide you with the best IMO possible, because if you should have a service connection, we want to make sure that that happens. And if we've provided you with something that seems, unhelpful or doesn't reflect what you've experienced, then of course we want to fix it. Does Telemedica offer counseling or therapy to veterans or their families? Currently, we do not. That's something that we're hoping to expand in the future. We know that the VA is pretty backed up in terms of what they can provide for veterans, families, spouses of veterans, and a lot of you need more support and more help than they're able to provide. So we are looking into expanding that service. However, right now we don't do that. And what that means is that when you meet with your psychologist, you should know that you're going to go over your history. They're going to ask you a ton of questions. They're going to try to be supportive, but it's not a therapy session. If you do need therapy, however, most of our psychologists have excellent resources and recommendations where you can seek that out. And of course, if you can seek out the VA and they're able to see you as much as you feel you need to be seen, that is an excellent resource for all of you. Any other questions? Well, it looks like we are running out of questions. I would say that when you do need to prep for an evaluation, you should make sure, again, all those documents are uploaded to your folder. That way your psychologist can use that as specific evidence written down in the IMO that the VA cannot refute. The other thing that you're going to want to do is make sure that before you meet, you have a good understanding of why you think you have a mental health disorder. Listing, there's a lot of mental health disorders that overlap for us as psychologists. So sometimes you may feel that you have a certain disorder and it turns out we give you a different diagnosis. That's because as a psychologist, you have to go through 13 years of school in order to get your doctorate. And so we have a really large knowledge base of mental health disorders. So although you may say, I feel really scattered, I can't concentrate and think it's ADHD, well, depression can also have those symptoms, and so can anxiety. So it's up to us to ask you the questions that we need to ask to come to a conclusion. It's also very important that you be honest and that you be willing to be vulnerable. And at the same time, understand that this is a stressful event for you. If you have an upcoming evaluation with one of our psychologists, make sure that you have an easy day, that you get enough sleep the night before, that you know that this may cause some disturbing feelings for you. It may make you feel sad or upset or angry, and be ready to talk to someone that you trust afterwards. So that can be your coach through VA claims. It could be your therapist. It could be your spouse, a buddy, just anybody who can support you after that process. Sometimes we have veterans who days after feel like a lot of things are stirred up for them. And in those instances, it's very important to have someone to lean on. After the appointment, you should know that we write our IMOs within 14 days. However, I have been pushing our psychologists to upload them within 48 hours. Once those are uploaded, you should look through it and make sure that you feel comfortable with the evaluation and what the psychologist concluded. If you don't feel comfortable, make sure that you contact customer support so that we can fix it, or we can help provide some clarity on why the psychologist said what they said. It's also very important that you provide any evidence of psychotherapy. And also another thing our psychologists are looking for that I don't know many of you realize is that we're looking for your functioning and how you were before you were in the military. So if you can provide us with evidence of how you were before the military, then that is also very helpful to our psychologists, because they can say that military service did or did not impact your mental health and your functioning. The other thing to make sure that you have is a list of your mental health medications. So that's things like antidepressants, mood stabilizers. A lot of our vets are on prazosin because of nightmares. Including that list and making sure that you have a list of all of the mental health practitioners you've seen, as well as specific dates when important events or traumatic events happened for you. That way we can reference that and make sure that your claim has the best chance of being accepted by the VA. And then if you need anything afterwards, the best thing to do is, again, to contact customer support. All of our admin team at Telemedica are highly responsive and working very hard for all of you. So if you have any questions after the evaluation, please contact us. We are open and want to help you. Any other questions or thoughts? What do you need to do after the appointment? After the appointment, you don't really need to do anything. It's when I evaluate veterans, what I tell them is that it's time for them to hurry up and wait, which can feel very frustrating. However, you will wait. Like I said, maximum that 2 weeks, you'll get your IMO, you'll review it. Now, if that IMO is late, so it's past that 2-week mark, you should contact the help desk, and we will make sure that that gets done right away. If the IMO is triggering, meaning that it upsets you, it brings things up, it's very important that you reach out to the people in your life that are supportive. And I recommend that everybody who has served see some kind of psychotherapist or some kind of therapist, whether it's a social worker, a psychologist, a counselor, anybody at all, because as you begin this process of trying to be service connected, it can be very difficult and very stressful. It can bring up lots of things from the past. And so making sure that you form that relationship either during the process, after the process, or before is what will also help you feel better in the long run. Because in the end, our hope at Telemedica and Valor Telehealth is that you get the services that you need, not just the money that you are due, but that you feel better overall. And to feel better overall, we often have to develop those counseling relationships. So looking into that, because the benefits process can take a long time. Many of you have already have been service connected for physical difficulties, and you know that that process is very long. So getting support throughout this process is very important. But generally, once that IMO is complete, you'll see it, but you hurry up and wait for the IMO. And if you feel very stressed about the process while you're waiting, a good person to also talk to is your coach if you are using VACI. Any other questions? How much time should I set aside for a mental health evaluation? Our mental health evaluations last 45 minutes to an hour. If things do go shorter than 45 minutes, immediately contact customer support. It is very hard to get all the information that we need about you in less than 45 minutes. In fact, some of our providers go all the way up to an hour, and at times, if it's a complex case, we'll go longer. And you should know that too. Sometimes our providers have to be late because we are dealing with a complex case. And just like you would want us to take the time to evaluate you and offer you that extra time and not cut you off or have you have to meet with us again, we ask that all veterans understand if we are running a little bit behind because we're finishing up with someone else. However, make sure that in that 45 minutes to an hour, you are in a quiet place, no distractions, nobody else can hear what's going on, and that you're also dressed appropriately and that you are in a clear state of mind. Sometimes with telehealth, it can be tempting to do things in the car or mute the sound or turn off the camera, but we need to be able to see you. And you need to be able to see us so that we can talk about these very important things and feel that sense of being supported. The other thing is that the VA does ask us to complete something called a mental status exam. A mental status exam does include looking at your hygiene, your eye contact, your ability to carry on a conversation, remember things, all that kind of stuff. And if we can't see you and there's too many things going on in the background, we won't be able to assess that correctly, and that could harm your claim later on. Other questions? Okay, it looks like we have run out of questions for this event. Thank you so much for watching. Thank you for your questions. Please reach out to us if you need anything at all. We are here to support you and provide you with as much information so that this evaluation can be successful. Again, customer support, submitting a claim to the help desk, a ticket to the help desk. That's the best way to make sure that your concerns are heard. And we all look forward to meeting with you and providing you with help and guiding you through getting a service connection for mental health. Thank you.